cannabis clinic I started because of my family. So my mom and my dad are both medical marijuana patients in Michigan. My mom uses it to treat her fibromyalgia, and my dad uses it to treat his PTSD and also chronic pain. And when they first were trying to become patients in Michigan, it was really, really difficult to find a doctor who was willing to do anything with medical marijuana, very hesitant to sign certifications. So here in Missouri, legalization for medical marijuana recently happened, and we wanted to make it as easy as possible for patients to get their medical marijuana cards. So when a patient makes an appointment with us, they come in, they bring their medical records with them, their state license or their state ID, and they're able to see a doctor who can provide them with a medical marijuana certification.
In my experience and working with colleagues and other physicians and other pharmacists, a lot of people just don't know a lot about marijuana and its benefits, and so they're reluctant to ever recommend it because they are not educated enough on it. And so that's kind of where I saw an opportunity to help, is to kind of help close that gap between providers who don't know with providers who do kind of know the benefits of it, and then help make it more accessible for those patients who it does benefit.
For most of my childhood, my mom, she was diagnosed, I think back in 2003, with fibromyalgia. And so for most of my childhood, she was trying different pain medications that had varying kinds of side effects. And now to see her, I'm an adult, and to see her on, using marijuana, it's completely different. The whole time I just thought my mom was grumpy when I was a kid, but it turns out she was in really intense pain.
I have dealt with a number of individuals, treating individuals' chronic pain and wellness issues, but this will be the first time having the availability of this medical product. Medicine is somewhat slow to adapt to new treatment paradigms. Utilizing marijuana for chronic pain, chronic medical conditions is relatively new, and I think we're at the cusp. This is at the beginning, and medical research will follow what we do. The demand is unbelievably high. People want to feel better. It's a legal way of obtaining medications to maybe reduce opioid dependence or use, or to eliminate it. So it offers a whole new frontier.